Welcome to whofooadventures. In this episode, we will be exploring the connection between diet and COVID-19.
We'll start with a segment from Dr. Hana Kahleova and Dr. Neal Barnard from the Physicians Committee for Responsible Medicine as they explore the connection between nutrition and asthma.
Dr. Hana Kahleova, welcome to the show.
Thanks for having me, Chuck.
And of course, we can't neglect Dr. Neal Barnard, who has also taken the time to join us today.
Thank you, Chuck.
Let's talk specifically about nutrition here and asthma. What are the do's and the don'ts? Talk to me about the correlation here.
So let's start with some exciting studies.
By all means.
Dairy is one of the main dietary components that seems to be harming asthma. It seems to be increasing the prevalence of asthma and also impairing the symptoms once you have asthma.
The important thing is that it started out as individual observations. It was a person here and a person there who'd say, I got rid of dairy and my asthma went away. And so many people have seen that it's great to see what happens when you actually put this to the test in clinical trials. And you do see a number of people where their asthma improves, so they're no longer using their inhaler so much, or maybe not at all, and other cases where the asthma just flat out goes away when they avoid dairy. And as you said at the outset, right now is a time where there's a respiratory virus. And the cause of death of people who succumb to COVID-19, it's typically respiratory collapse, pneumonia, also some cardiovascular conditions, all of which relate to diet. So let's say a person has asthma. They're listening to this podcast. They're listening to what Dr. Kahleova is saying. They make a decision, okay, almond milk is sounding pretty good right now. Forget the cow's milk products. And I might mention even goat milk and sheep milk. They are still animal-derived milk products. And what we suspect is the issue is the animal protein. We talked a lot about the fat, the cholesterol, the estrogens, but I am going to guess, back me up on this and see what you think, but I'm going to guess it's probably the protein that's eliciting this inflammatory reaction in the lungs, and that makes you a setup for further respiratory issues. So now is the time to ditch it. And I know I could just hear the parents who are thinking, wait a minute, I've got to give milk to my child. They need that protein. Your children are going to get plenty of protein without animal products. They do not need dairy. They're better off without it.
So it's the protein, but it's also the fat. So a high-fat diet per se also increases inflammation in the respiratory tract and in our airways. So it's important to keep the fat content of our diet also fairly low. Not only skipping the dairy, but also keeping the fat content low. And also the connection with COVID-19. So the fatality rate without any comorbidities right now is roughly under 1%, 0.9%. However, for people with asthma, it's 6.3%. And it's even higher for people with cardiovascular disease. It's 10.5%. So that shows us the importance of taking care of your asthma and of your cardiovascular disease, and the same is true for diabetes and our other comorbidities.
One of the things that we've also talked a lot about on this show before is how effective a plant-based diet can be as far as protecting the heart. I would assume that a lot of you get that same protective element with asthma here, correct? If you adopt a plant-based diet, what did you guys discover?
Exactly. There are different components of a plant-based diet that are protective. So we have known for a long time that fruit and vegetable consumption are protective against asthma development, but also improve the symptoms in people who already have asthma. The effect is fairly strong, and that's why it's even in the official recommendations for people with asthma to consume 1.5 to 2 cups of fruit per day and 2 to 3 cups of vegetables per day. However, only about 12% of Americans meet these recommendations on fruit intake, and only 9% consume enough vegetables according to these recommendations.
Typical government guidelines push dairy for everybody. And it's really unfortunate. They should not do that. Now, I should hasten to add that when we're discussing the benefits of getting away from dairy, these are things that turn out to be important in general. When people avoid animal products, their likelihood of developing high blood pressure goes down. Their blood pressure itself will go down to healthier levels. Their likelihood of developing diabetes will go down if they avoid animal products. If they have diabetes, it'll get under better control. Ditto with asthma. Nobody has done the test to see if on a vegan diet, are you more or less likely to get COVID-19? Nobody's done that. But what we are noticing is that if all of the signs point to keeping yourself healthy, all those underlying conditions that make a person more vulnerable to the effects of the virus, they are all subject to the effects of nutrition. So put nutrition to work.
But I was also looking at some specific foods that might help protect against viral infections. One of them is garlic. So garlic seems to be like pretty good for the prevention of viral infections. Another one is resveratrol, which has been found to be helpful against many kinds of viruses, including influenza, respiratory syncytial virus, Epstein-Barr virus, and many other viruses. So that's another component of many plant foods, like for example, contained in peanuts, but also in grapes and strawberries and blueberries. And a third food that might be helpful specifically against viruses is ginger. So garlic, resveratrol, and ginger seem to be working against viruses specifically.
A number of these things have been tested, and I think we have to be cautious all the time because it's tantalizing to think, I can still eat my pork chops as long as I have some ginger in a capsule for breakfast. And I don't think we want to go there. So as Dr. Kahleova says, you got to look at the evidence. Look at the studies. Look at the quality of the studies. Look at the consistency of evidence. And none of this, I said this before, but let me say it again. People haven't tested ginger or garlic against COVID-19. What they're doing is they're looking at their effect either on immune function or their effect on other kinds of viruses that are similar. And then when this pandemic came in, they're saying, okay, here's what we know from other viruses. Let's apply it now.
Right.
See, so that's where we are.
In this next segment, Dr. T. Colin Campbell is interviewed by his son Nelson as they explore the connection between COVID-19 and our food.
I've invited my father, Dr. T. Colin Campbell, to join me from his home in upstate New York. Known by millions around the world, he did much of the research to validate the health benefits of a plant-based diet. Many people are saying we have two strategies for dealing with this pandemic: testing and social distancing. Both are important ideas. But you say there's a third. What is that?
It's the food we eat and the nutrition that is produced from that food.
So that's an idea, this connection between this virus and food. That's a connection that's backed up by the statistics. As you and I have discussed, many of the fatalities have been people who unfortunately suffered from previous medical conditions. 99% in Italy, according to a study by the country's National Health Authority. And of course, we're seeing a similar situation here in our own country.
And what we learned was that a whole food, plant-based diet that's containing, quite frankly, no animal protein, that kind of diet actually repressed the conditions that would lead to a variety of so-called Western diseases, including cancer, heart disease, and diabetes, and so forth. What we saw was that as the consumption of plant-based foods, vegetables, fruits, and grains, and so forth, as that increases in the diet, it tends to actually increase the amount of the virus being inactivated by the formation of antibodies. Yes, we measured both the antigen, which means active virus. We also measured the antibodies to the virus, which is essentially the inactive form.
So you measured the levels of the antibody to the hepatitis B virus, and you also measured the active form of the hepatitis B virus, the antigen. And did you see a relationship between those levels and how many plant foods that people were consuming?
Yes, the greater were the proportion of people with more antibody, they were the people who were consuming more plant-based foods.
So what about the active form of the virus, the antigen? Did they also have less of the active form of the virus?
there was a high correlation between plant-based food consumption and the formation of antibodies. The greater was the consumption of animal-based foods, the greater there was of the antigen, that's the active form of the virus.
So if you had to summarize all of this research and what it means for our viewers, what would you say? How would you succinctly summarize that for people today who are concerned about the COVID-19 virus?
There's two parts to that question. First off, the whole food plant-based diet, rich in antioxidants and fiber and all the good things that we know about plants, the greater the consumption of that kind of food, the lower is the risk for the chronic degenerative diseases which actually predispose people to the COVID-19 virus. At the same time, that diet, rich in the plant-based foods, fiber, antioxidants, and so forth, also seems to have the capability of converting an active virus to an inactive virus. It turns out the kind of nutrition I'm describing from a whole food, plant-based diet is very comprehensive, and I'm going to suggest, with a lot of evidence, that it controls viral-initiated diseases as well as the chronic degenerative disease at the same time.
And by the way, I know that you're not saying that if you eat plants, you won't get infected by the coronavirus. What you're saying is that, if we get infected by the coronavirus, that eating a healthy diet will minimize the risk that that infection progresses to a serious state. Is that right?
You said it better than I could. That's perfect.
Thanks for watching. Keep safe, keep your physical distance, and don't forget to eat more vegetables and fruits.
And don't forget to subscribe for more whofoo content.